In January of 2020, the first case of Covid-19 in Europe was confirmed in the city of Bordeaux, France. The confirmed case was a man in his 40s. He was immediately placed in isolation, with the French authorities attempting to trace people he was in contact with. That day, the former Minister for Health, Agnes Buzyn, said the risks of propagation of the virus are extremely low. Unfortunately, the Health Minister proved to be wrong as cases began to ramp up across the country. I spoke with French native Amandine Verbiese, who told me about her experiences of the tight restrictions.
We have a curfew at 6 o'clock, so we can't really have any social life. But on the first lockdown, it was really heavy. We had to fill documents every time we would go out to tell why we would go out. So either it being working or walking the dog, and if you didn't have that document, you would just get a fine. So that was not fun.
What was the fine?
Having to fill 135 euros the first time. Then the second time it was something like 300, and then the third time it could go up to 5,000 and prison eventually.
In April of 2020, the number of COVID-related deaths shot up drastically, with more than 10,000 people dying in the first 2 weeks of that month.
For me as well, I think we were all shocked. We didn't think it would go as far. But yeah, it was kind of a rush to come back to France, get a flight and everything. It was a bit of a shock, and the restrictions were pretty heavy, pretty quick as well. So we didn't really have time to kind of adjust to this. So a lot of people were revolted in France. But yeah, I mean, they've been pretty strict about the lockdown. But at the same time, France is a big country, and people were just not respecting the recommendations at first. So,
due to the closure of several industries, many people in France were forced out of work. Baking, exercising, or learning a new language were a distraction for people who remained in quarantine. Amandine discovered her method for keeping busy during the lockdown was through the use of technology.
I'm involved on online communities for gaming and such. So I'm playing quite a bit of games, Netflix, and just keeping in touch with everybody through video calls and such. And yeah, I do go out, but I try to limit because I live with my grandmother, so I can't really break the rules too much, just for my own sake and my family's.
The vaccination rollout process by the French government prioritises people within the vulnerable category to receive doses first. This includes health professionals over the age of 50 and people who are put in the high-risk category who may have underlying illnesses.
I'm not sure how many people have been vaccinated, but they are complaining that it's not enough. But hopefully by this summer it'll slow down, thanks to the vaccine. But they are vaccinating elderly at first, so they're not the ones who are contaminating everybody, just for safety reasons, obviously. But yeah, so as long as they're still vaccinating the elderly and not vaccinating people who are working and going to college and school, I don't know when this is gonna end.
They are aiming to have 1 million people vaccinated by the end of February and approximately 14 million of the population by the summer.